Hello, everyone, and welcome to the Health Innovation Playground. Today, we have a very exciting episode. We have Frederic Llordachs, and I'm so excited about this episode because now we have
Don't get so excited. Don't get so excited. Don't worry.
it's a very successful case or a very successful person. Like, I look at your LinkedIn trying to find a way to introduce you that serves you well, but I couldn't. Like, you call yourself a digital health trailblazer, but you're originally a doctor, you graduated from medicine. Most significantly,
But I haven't practiced since 2011. So if you feel sick, please don't call me. Okay.
Good one.
Very important thing. Very important thing.
Everybody take
you
note.
also co-founded Doctoralia, which is one of like a very big platform right now. We want to know about everything, but first, how would you introduce yourself?
Well, this is more or less what you said. So I just went to the medical school, and then when I finished, instead of going to the usual pathway for healthcare, for a healthcare issue, I had an accident and I broke my arm very badly, and so then it was not so easy that I could practice normally. So then I just had as an alternative doing my MBA at the SADE, so going to a business school. If you have been a doctor or you have been trained to be a doctor, you have no idea about management issues and this kind of things. And let's see the non-clinical side of medicine, let's say, And this is where I learned a lot, and very funny time to be on the other side. And then I started to work in insurance companies here in Spain. So then, because of that, this is when I was in touch with the internet and things like that. That in my old times, because I went to ESADE the last century. Okay, so not this century, the other one. Okay, so this is remarkable. So I'm the guy from the other century. Okay, so
we were just born. I think
I'm a time traveler in some way. So and this is how all this started. So then realizing that the internet could have an impact in the future, this is when I had this idea to do things in this space, and as a plan B or as a pet job, we started a project called Doctoralia, and this is the pet job started to take traction when Mr. Steve Jobs did this, just launched the iPhone, and in 2007, and this is when, let's say that the world get digital, the jump from the internet in the office in corporates to the home to your handheld was definitely the first step, and we had a project that was Doctoralia that was ready in the healthcare space. That was more like a yellow pages of doctors than other thing, but that was very, very optimized and very popular here in Spain for years. So we were for 3 or 4 years the most visited web page in healthcare in Spain. That is more than insurance companies, than hospitals, than ministries, nobody had so many visitors looking for healthcare than Doctoralia did. And this is how, well, and the other thing that was that we had in mind all time building a platform that helped the patients to reach doctors. So the online appointment system was in the early beginning. So in healthcare was not so easy to get an appointment like now. So then with this in mind, so making easier getting appointments, this is how we started to work in this platform to build a layer on top with these appointments and with opinions and different layers that gave a lot of information and empowered the patient for one side and made popular or make easy to get or to reach doctors and healthcare professionals. And we started here in Spain, and as the things went well. We just started to look for other countries. We tried in Germany. There was a guys called Jameda. We tried in the States. There were dozens of proposals, but in Latin America nobody was doing nothing like that. So we started to do operations with Doctoralia in Latin America, but like Facebook did, so directly from Barcelona to the world. So no offices, no people abroad, just locally and from Barcelona to Latin America. And it was a huge success because we had a source of revenue that were the Google ads that are also from 2007. So magically, we were in this crossroads where you have something that get money. You have something that makes popular the internet for everybody, and this space started to grow in that moment, and we really we had money from minute zero that we launched that because of the ads, and as many users we had, as many money we got. So then it was easy for us to build a team that really make it grow here in Barcelona, make it grow and grow and grow, and it was definitely a huge success in countries where nobody was looking at, because we think in the internet and everybody's looking for Germany, for UK, for France, for the States for sure, but countries, Latin America, Mexico, Brazil, nobody had in mind Mexico and Brazil, that are massive countries, massive. Brazil is as large as Europe, the whole Europe. So then, and there was not a way to reach easily a doctor there. So then we started in this space. We started to grow and to get money and to build a team. And this was the first part, I say, of the adventure, because in the thing it was that in 2016 we merged with a Polish startup called Llamalítica that was doing more or less the same as we did, but strictly in Poland and these spaces, and that had funding to be buying other companies, and the thing is that we merged with them to build in 2016 Doc Planner, and we were a team in Barcelona of 75 guys, more or less, and they were about 150 or something like that, less than 200 in Warsaw. And the thing is that nowadays the planner is a unicorn, is one of the digital health unicorns that Europe has, and operating in 13 countries, was able, for instance, to buy these guys in Germany called Jameda some years ago. And well, it's millions of users and millions of online appointments, and this is and thousands of employees. That is also the other side. So we have 13 offices around different countries. In countries again that are not maybe the most poshest, I would say. No, maybe not so apparent as the States, but they really are moving a lot of people around, and that are giving a lot great services to a lot of population. And this is something that we started with 3 guys here in Barcelona, just saying, well, what if we take this domain called Doctoralia and let's do something related with healthcare, and it has been a long journey but it's funny. And in fact, last Friday was the 10-year anniversary of our merge with Llamalítica to start the planner as it is now. So in 10 years, we just let them do everything, and we just move away, and they have done. We went from 0 to 1, let's say, or from 0 to 5 million, and they have gone from 5 million to far away, and this is the short, in short, more or less all the history that we have done for so many years, and having a lot of fun in the road, and learning a lot, and failing, but especially being lucky. So when I say, there is a plan, no, there is not a plan. So you just no, this business, no, because you had we had no idea what we were doing, in fact. So well, one step was followed by the other, and we had a lot of good decisions in our pathway, but there was not. I mean, there was not a master plan of the universe of conquerors, or no, it was something more basic, I would say, and based in feelings and based in trying to be nice guys. That is also part of the history, So I guess that if we were not, at least the original team in Doctoralia, we didn't have a partners agreement. We didn't have nothing like that. So it just was verbal agreement, and the stocks that you just take the shares that we had in the beginning, and it was more or less like that. And everybody had his role or their role, and we were always agree with the decisions that it was. I would say that the most difficult part to get for any startup or any project. So putting people together, egos apart, and just thinking in what was the good thing for the project. No more than that, I would say. Questions? Tell me something.
Thanks so much, Frederic. That was a plethora of knowledge that you shared with us already. Very grateful. I love to hear how your entrepreneurship journey went from the yellow pages of medicine all the way to actually a unicorn. And I want to take a couple of steps back here and really pause on the first couple of challenges that you encountered. You mentioned there was a big part and a big emphasis on market expansion, right? Going into those markets that maybe are unthought or unheard of, especially at that point in time. But early in those years, when it was all coming together, what would you say were the hardest challenges that really took time to figure out?
In fact, the hardest challenge is always hiring people that really can work with you, So there is a lot of people that are rock stars. There is a lot of people that are very good at what they do. But at the end of the day, having a team is a team. A team has to work as a team, And I always make jokes about how difficult it was to be hired in Doctoralia in the early days. So we had an exam. So going to NASA probably it was easier than getting into Doctoralia as an employee. So we had a lot of processes in the middle, and because you must be really, really top developer and things like that. But at the end of the day, the people that really succeeded, it was the people that was a good person. So it was good people, no, and this is probably the idea, because it's not so easy to get. There are always difficulties, and when you have a small team, you don't have a second chance to do things right. Okay, so in the beginning, we had some trouble hiring. I mean, I remember that we hired a guy that unfortunately he was on drugs, and we didn't realize since one day in the office. Okay, so that was absolutely, and we only were less than 10 in the office, so it was impossible to realize how high was the guy when he came. Okay, so even we had to call an ambulance to make him calm, and I think that this was a great experience, because on the paper he had an amazing experience, and when he was not on drugs, it was marvelous. But the problem is when you are believe it or not, a 24/7 employee. So you must behave on responsibly, because when you finish what you do since you finish your daily job to when you go back to the job, can have impact in what you do in the next day, And this was an experience, and really moved my business partners and me to look for somebody to take care of this hiring job. That it was not only based on what you do and what you know, but how is the conversation? How are these soft skills? How good are you? And that, and I really that our first human resources responsible manager, she was absolutely amazing on that, hiring developers, and she explained absolutely insane histories about guys coming with the parents, guys coming with guys trying to catch her, not just to go, well, let's go outside and all that. We're in the middle of the interview, so things that can be in a soap, in a TV show, because it was amazing histories about that, and this is what we needed really, somebody to take care of these soft skills that are not so soft, that can can give you, can put you on trouble in the daily relationship in your task. And I'm very proud of how something that happened when we merged with Llamalítica to become the planet. It was that in 2 to 3 years there was no people quitting, people leaving the company. That is something that when there is a merge used to happen, because you feel that you lose your role or there is a competition or something like that. And really, I guess that I tend to think that most of our advantage against other players that were coming to this space, it was because our team was a compact team, and it was compact because it was nice people that was willing to do their job properly and that really had this energy for doing things right, and this is something that's important. So people is important in when you start a project, and the people that is with you and the people you are related with will have an impact in the future. So take care, be careful with the people you hire, and if there is not a fit on that, just let them go to another place as fast as you can, because it's the best way for everybody, in my opinion.
So interesting. You mentioned also that you went through a lot of failures, and I know the journey of entrepreneurship is a roller coaster always.
Yes.
Can you remember any of these failures? What got you out of it, and what always made you move forward?
Well, the failures we had, everybody has. If you do nothing, you never fail. Okay, so this is something that I used to explain, and the people in corporates always say, really, but this is the fact. So we started projects burning a lot of money that had made sense in our minds, but never were able to see the sunlight because we were too ambitious in some of them, no? And others like having the opinions, or going to some countries, or going to countries like France where there is. I don't have nothing against French people, but it's difficult if you are not French establishing a business there. Okay, so and then we started to do things there. We realized how difficult it was, and we moved out of that. So. But we had a lot. We did a lot of choices. But and you never know how important is the impact that your decision has in the future. So things that you think that they're great. We started a project that was great, that was trying to do middleware to put together all the online appointment systems around the world, if possible, and in order to be the guys of the middleware, okay, to be in the middle of all that. Never succeeded because it's very difficult. In fact, and at least in the technology there was 10 years ago, it was not 10, 50 years ago. It's the technology of making integrations between online appointment systems was tricky. So too many people had to give you access to a lot of things, different technologies, different speeds. So it was a massive failure. That this is still in our hearts, because we realize, we know that this would be good, not for us as a business, but for a lot of people that really could have access on that. And this was, for instance, part of the. I recommended to buy Tempo, that was an Italian company that did more or less this that I'm telling you here, but here in Spain for insurance companies, because at the end of the day, is making easier this demand offer marketplace, no? And it was part of the ideas that you have, that somebody will do it one of these days. When I don't know when, I don't know how, but this way. Maybe AI is the technology that is ready to do that with less friction. Maybe now is the time for do something like that. But the other thing is that, for instance, I still remember going to an event in 2012, I think, where there was another startup doing the opinions system. No? They had a marketplace with opinions about doctors, and we were not still in that page. And I called my colleagues, say, hey, we should do that. And they told me, never will do that. We will never do that because this is bad news for everybody, and that will never. Okay. So I forgot that. And then 2 weeks later, my colleague said, hey, the thing of the opinions about doctors, we got it. Okay, we will launch it today. So come on. So this is how we did things. So there was a short time of reflection and action. Just let's try it. Let's try it if it works. Let's try it. And just this idea of trying things is the one that really maybe was different for this healthcare space. No, maybe it's more usual probably in other, not in Spain, not in Europe for sure, but also not in the healthcare space, where you think that because it's over-regulated and there are so many incumbents affected, and everybody is very conservative. And well, we tried things, we started to do things, and things went well, I must say. Yeah.
Thanks
I'm
for
telling you a lot of things. Come on, too many things.
Yeah, definitely. We're loving this. Thank you for sharing all of your experience. It's extremely insightful. Now we've talked a little bit about Doctoralia, Doc Planner, the merger, and so forth. In about 2020, you left Doctoralia, right?
Yes.
And that was after more than a decade. Can you talk us through what made you choose to actually leave, and how did it feel to actually hand over something that you've built from scratch to other people? How did that feel?
No, but the thing is that you know how bad was COVID for everybody, and the lockout and all that stuff, and I was working in a corporate, because when a company really, instead of having these ideas and the mentality of doing fast things and all that stuff, you have more than 3,000 employees, you are a corporate. So believe it or not. And I had my feeling when seeing how bad were things and so many things that could be done, I said, come on, I feel that I should try to do things. I had invested in companies that were not doing the things as I should, as I probably had done it. And is when I said, come on, I can do it better than them. And I want to start again from zero, because I'm an old guy, but I still know better than others how to do a lot of things. So let's try to go for it. And they said, I love you very much. You are doing it very well. If you need me, call me. But I'll try to do new things. And because I think that there is room, and it was a good moment to start new projects, because it looked like the world was asking for solutions that were never been asked before, no, and that people was definitely digital, and because of that, there are a lot of things that could be done, and this is how I said, I live, enjoy, and that's all. I still have a small amount of stocks of the planner. So I'm very happy with what they do, but I started my own path, my own way, and I'm having a lot of fun. That is also part of this. So it's not being part of this PNT and the procedures and the meetings and the committees, and come on, let's go back to rock and roll. That it was let's think it, let's do it. Mindset is I am enjoying that a lot, and this is what I said, and this is what I'm doing, and again, I'm having a lot of fun. So seriously. with Llamalítica. Okay.
Yeah,
Thanks
we
for that.
wanted to ask about that. Like, after handing off Doctoralia, you could have done anything else. Like, you could do advising, you could chill at the beach forever. But
Yeah,
what
but
made you?
this is always bad news. So there is a lot of people that have a lot of trouble with justice, with drugs. We know, come on. It's good to be busy in life. Okay, so maybe you can be busy. I don't know, just adopting kittens or whatever. Or maybe there is a lot of all entrepreneurs that want to be investors. I hate investors because they only think on the bottom line. They forget the essence of that, the essence of starting something, the essence of having a vision. So they only look for the vision is the bottom line vision, and this really is stressful and is sad, especially if you have been in the other side, trying to push your colleagues that are trying to start something. No? And I'm not very happy with this investment side. And and what could I do? I could go to be a doctor. I don't love it. I like it, but I'm not as good as in other things. And I thought that I was good in at least envisioning what could come and what could be done. And this is how I started to try to launch a project based on AI that could help doctors, patients, all the people that is incumbent, because at the end of the day, all of us will be patients. So let's try to work when in something that could help us when we became patients.
And how did it start? Did you always had this idea, and then when you got the time, you launched it, or
Not really, not really. No. I mean, the things came. I always say I'm a lucky guy. So there is a lot of people coming to me and saying things and explaining things. And I had a good friend, very good friend, that came. I had started something in the chronic field space, and I had a lot of trouble with my business partner, and I just quit. And they said, "For you, enjoy." And when I was just having in mind what to do, even I got the basketball coach license in this space, just things to be done. Well, let's go for coach. And I was with this colleague that is in the circular economy. That means that he manages trucks to get rubbish from one side to the other. Okay, so this is a circular economy, just carrying garbage. And he told me, I had 6 guys taking notes to my EIRP to put all the invoices of the truck drivers, and now I'm using AI. Instead of 6, I have half employee with that. I said, wait. So you take invoices, and who puts the invoice on your EIRP? AI. So I challenged him. So I gave him 8 results of blood tests from the same person, and I challenged him. Okay, put them together with by item, by date, and put on top the items, the parameters that are alterated, that are badly, to make it easy to be found. And he did it with AI in half an hour, and I said, let's go with this because we must do something fast on that, because this will change how is healthcare. Because one of the main problems in healthcare industry is interoperability, and interoperability is based in putting together apples and apples, pears and pears, no, and watermelons with watermelons. And it's very difficult to put them together because it's expensive. But if you have a way to cherry pick the data from the same patient in different times and put it together in the way you want to see it as a doctor, you have solved this problem. And this is what we had in mind. Just AI was the right tool, and is the right tool, and will be the right tool to cherry pick the data, put it together, and helping the doctors and healthcare professionals to do their job in an easier way. Because now they live in a world that is digital, but that is not integrated. So there are dozens of PDF files, Excel files in different spaces. So put them together is very hard. Most of the time they are printing, they are marking, they are putting the information together. We can help them to put the information they need together. And this is what we started to do with Llamalítica. Just first of all, the Llamalítica comes from analítica, that it is how in Spanish is called the blood test, is analítica de sangre, is the blood test, and we needed a name, fast name, LLMs, Llama, Analítica, the blood test, Llamalítica, .com. It's free. It's mine. Brand. It's free. It's available. So let's get it. And in 5 hours we had everything. So it's about doing things fast. I would say, and do it with passion, because we have learned a lot. This was almost 30 years ago, so we have learned a lot of all these changes. We have made it deep. We have gone very deep in a lot of spaces that are now on that, and is an amazing. And there are a lot of things that still can be done that we will do in the short term, and having fun. That was an important thing too.
Having fun definitely sounds like it's a big part of it, and we love to hear that.
Absolutely.
It does sound like a challenging but really entertaining journey as well. I wanted to circle back to AI, since we talked a little bit about it. So there's a school of thought that says doctors are notoriously resistant to new tools. And AI tools, fall into that category. And you probably lived this experience.
This is the reality. So when people say doctors are innovative, is because they don't know doctors, because they are guaranteed. So you have been trained to give a solution. So if you don't have a better solution, I will not try it with my patients. And this is about that. So they don't want to be the first one or the second one or the third one, but they neither want to be the last guy to get the solution. So then it's just managing that expectation of having something that is new but has been tested before. And this is the challenge, but for everything. So pharma companies have that on mind, and regulation is based on that. So you need a lot of clinical trials and things like that. So then launching a drug, for instance, since you have the drug, the molecule, let's say, and since it becomes a pill, it lasts 10 years. So that's a lot of time to think, to change, to check again, to recheck. Okay, so and this is the mindset in healthcare. So it's a slow and slow, at least for the. I would not say only for startups, but for the people of the 21st century. For the I've always made the job for the Tinder people, because when I was younger, we won't have a relationship with somebody. You went to a bar or to whatever. That happens now, but now it's easier. You go to Tinder, that point, okay, that's it. So or Amazon. So you had to spend your afternoon with the car going to the mall. 3 hours, 4 hours to put everything together. You just go to the screen, check, and you have in the afternoon in 3 hours in your door. And this is the reality. And the bad news is that in healthcare things are not based on this mindset, And then there is a friction between the 21st century people and the healthcare system that is still in the 20th century paradigm. That is still only the name of patient gives you an idea about which is the role of the sick person. So patient means that you must be patient to be attended. Okay, so you are a passive figure. You are something that has to wait. And this is against we see the world now. No, yeah, let's try to go on to push. To have all the rights. No. And I think that there is a lot on that technology must change because when things go faster, you can realize or you can stop things, bad things, cancer, things like that. In an earlier stage, that means better results in clinical terms. So then there is a lot of putting speed on that really is in this 21st century mentality, and there is a lot of talk about that. So what you were selling, Gigi, sorry for just cutting you, but this idea of doctors are innovative. No, they are not, but they realize that there are tools that can help them a lot. And I think that AI, at least AI, is always on their mind now because everybody's using AI in healthcare and in no healthcare in the rest of the world. So then there is a lot of people thinking about how AI can improve their processes nowadays.
As a doctor doing all of this, what do you think it gave you as a mindset when handling all of these projects, or the status it gives you when you talk with other doctors or when you go in a boardroom? Like, do you think it matters?
Well, I see myself like some kind of C3PO, okay? So I speak all the languages. I speak the language of the doctor because I am one of them. I speak the language of the manager. I speak the language of the insurance guy. I speak the language of the pharma because I was working 1 year in pharma too. So then, at the end of the day, there is a lot of the challenges on communication, on how you explain things and how you understand the needs and the desires of the other side. So there is a lot on that. So even being able to explain to a developer or to an IT guy or to an engineer how should be the things, because doctors will not change the way they do things, so you must adapt that to their workflow. Is a challenge, but it's a communication challenge. So it's not and there is a lot on for me. There is a lot of that. No? So how we explain things, how we understand things, and how we re-elaborate everything. And there is a lot of experience. Yes, as a doctor, I was doing for 8 years. I was in the emergency services on call. No, so when you call to a doctor here in Catalonia, there is an option that it was me on nights and weekends. It could be me. So I learned a lot to listen and to check if what is done, what is said, and trying to say things that people can understand. No? And I think that helps a lot. So from time to time I see very smart people talking in a very sophisticated way, too on top, no, and you lose your the person you're talking with if you don't speak the same language, no, the same level of technology, the same level, and this is probably why it's so difficult for us that we haven't learned the English from England or the English from the States to talk with these guys, because we work with less words. So then we play with our toys in communication, and this is difficult to be articulated sometimes, no? And maybe we are too rude for some of them, or we are too fast, or we are too, or maybe we are so there is our main problem is communication, and I guess that probably AI will help us a lot on that too, because it's helping when you want to send an email and you are really pissed off, you put on the email on the AI, I want to say that I'm not agree, but politely, because with your word you would say a lot of bad words, no? So then I have a lot of hope in how AI can help us to have a better communication, and that is the way to get things. You know? For me, that this is being on the same page. I love the expression being on the same page, because especially in the screens era, talking about sheets, it's funny. We are on the same page on the book, and it's funny.
Thanks for sharing that, Frederic. As we're coming to a close of the podcast today, we only really have a couple of questions left. And I wanted to ask you a little bit about the role of a doctor in the future. Now, Llamatica is working and it's scaling. Now, if that's the case, what do you think the role of a doctor could actually look like in, say, 10 years from now?
10 years is not a long time, a long span of time. It's in the next door. So more or less will be the same, but at least what we are trying to do at Llamalítica is trying to help them with tools. No? And I always have in mind this idea, when you have seen Star Trek or you have seen Star Wars, when you are having conversation with machines that are by far smarter than you in some things, in the information they have. This is the idea we have about Llamalítica and about electronic health records, for instance. No? That you as a doctor being able to talk with the electronic health record, because there is a layer of AI on top that helps you to do that. So if I want to have Gigi's analysis from thyroid analytics from the last 5 years, the screen could give me the results, but not using just putting it, just asking for that and put this together. And how is about that? So just having this conversation, that is something you have in your mind when we are writing, no? And I think that is more natural. It's like having somebody that is helping you a lot on a lot of things, or even asking you will have a less cash for you for an MRI to see this back, okay? And then you have I have 3 options for the MRI. How is in 3 days? Amazing. Okay, you got it. Send it to you. And directly just telling me, talking with the system will do that job. That is not the medical job, but is the medical assistant job properly. And adding maybe some a topping of medical knowledge just to help the doctor in some aspects. So when get lost, or there is something you haven't realized, or there is a change on the medications, or that being a doctor in the 21st century is being lost, living 6 months ago, because there are a lot of changes on the medical pathway from day to day, and just being only for that makes sense, having a tool that helps you. Hey, be careful because this antibiotic is not anymore in the market. Hey, be careful because this guy is taking this pill that has a small interaction in some cases with this other. No? So is having these tools to help to take decisions, because at the end of the day, the responsible for any treatment, there is no country in the world where the responsible for a treatment is a machine. So there is always a doctor that signs and that can go to jail if it fails, if something goes wrong. And I think that is important to understand that as long as there are persons responsible for the healthcare of other persons, we will be in the right place. And the tools that we are able to build around that will be the right tools that will probably help a lot to doctors and for sure to patients.
Very interesting. Very excited for these days.
It's an amazing era to be on healthcare and to be on technology. I think that there are for the next 10 years, we will do a lot of things with AI and technology that have been waiting for 24 centuries. Okay, so and in healthcare. And I think that this will be a good time to be in the next 10 years. There will be a good time to be a patient. Let's say never like never like before. Okay.
Okay, that was so interesting. I would like to finish off by one last question, and it's kind of a personal question. Because me, myself, I'm a doctor as well, and I did this master's in health innovation and entrepreneurship, which sparked a lot of ideas for me. And now, for the last 3-4 months, I've been working on a digital health app for back in Egypt, where I'm from. And to be honest, the journey is is a bit scary. There are lots of uncertainties, more and more signals that tells you to give up than what tells you to continue. What advice would you have, since you went through it all, not even once but twice? What advice would you give someone like me?
Well, there are two things. One is do what your heart says, no? And so if you feel that you don't feel comfortable, don't force yourself. I think that is important. And the other thing is the opposite. So just do it. Never like now to start something. Never like now to be on the first step of something, because everything takes a time. You come from medicine, you know how long are treatments, how so you recover from a hip surgery, maybe you stay 6 months to be fully recovered, things like that. So there is always healthcare is always slower. So as fast as you start now, as better for having the result as soon as possible. But on the other hand, don't force it. So it's a choice. I would also recommend you starting like a pet project. That is what I did, and when the pet project is bigger than the project you are in, just you can jump to that. And if the pet project becomes a pet project forever, okay, it can be a hobby. Okay, a hobby, an expensive hobby, or a hobby that gives you money. So, or rewarding hobby. So you never know. So, but for me, I was for a long time with the idea of starting something in the internet space, because when I left SADE, when I left the MBA, I had some proposals to do things and things like that, and I said no, because I'm not ready, or things like that. And but some months later is when I started to think, why didn't I try to do that? Because at the end of the day, is experience that I get. No, so then don't do anything that can make you that can make you be angry with yourself in the midterm, I would say. So just maybe starting something, not being ready, without enough team, money, project, idea, or the opposite, or just starting it and being able, realizing that is not working so anymore. No? It's very difficult to kill a project, because you feel it like a son, but it's not a son, it's a project. Okay, so this is very important to understand. This is what investors have in mind. They see you. They don't see you like an entrepreneur. They see you like a cow to send to the market. Okay, so then thinking yourself more or less in the same way. So okay, I'm having fun. This is good for me, for my family. That makes sense. I have options, and be honest with yourself, but I would recommend you just trying it, just in case, just for not thinking in the future that it could have been your great moment. Too many words.
It's the one thing and the opposite. So yeah.
But this is thing. So it's like the 6-7 of the guys, of the youngers. No, this is putting things one side to the other. So, I don't know. Yes, no, yes, and for sure there are days that you say what I'm doing here, but I mean you have you must be fun. Must have fun while you are doing that, or whatever you do. If you are enjoying being a doctor, I mean, or even being a manager in a hospital, or makes all the sense to me. I mean, I was in this road to the management, so I understand, and I have a lot of colleagues and friends that are managers too, and well, I understand them, and I can see even from time to time I have had proposals to become hospital manager recently. So that is very funny for me, because come on, I'm in the startup side. Like, how can No, because you would do it. Okay. But so then you must do what you really enjoy doing, and it was my answer. No, now I'm very motivated for Llamalítica. Okay, so then with the AI thing, and maybe if somebody buys me Llamalítica, I will call you to become a hospital manager, but not now. I'm very happy on that. Okay.
Well, that was a very interesting conversation. We really enjoyed. It was really fun sitting with you and getting your knowledge and experience. I hope you enjoyed it as well.
Well, I save a lot of money on psychologists, so because I just throw out and okay, it's outside now, it's yours, not mine. So it's more or less a lot of that. Don't worry.
Thanks so much again, Frederic. It was great to hear your personal experiences, and it was really, really fun to chat with you as well.
My pleasure. I'm always thinking that my English is never at the right level to explain all what the things that I want to explain, but well, it's at least I try to share it.
Thank you so much, and thank you to everyone listening, and see you in another episode of the Health Innovation Playground.